My parents are extremely community-minded and generous with what money they had. But I grew up during the Depression, and so there wasn't much of that. I was born and raised in western Kansas, a little town called Downs. My parents' farm was right in the middle of the state, and actually we're in the middle of the country. There was a pillar on our ranch that said the Genetic Center of the United States. And I went to a small school in eastern Kansas. I was there 2 years, and then I transferred to Creighton University in Omaha, where I got my medical degree.
When I first met him, he was working at the Salvation Army Hospital, delivering babies. He lived there, and we helped him through the last couple of years of medical school.
I enjoyed medical school. Most of it, especially the last 2 years, was really kind of fun because you're into the clinical part of it. But the years when you took the basic sciences, it wasn't that much fun.
We met at a local bar, which was where all the college students gathered, and he was just a wonderfully sweet, gentle guy, and I was crazy about him. My major was economics, and I had a teaching credential, which I used for a few years, grade school. I taught in Omaha for a while before we were married, and then in Los Angeles for a while he was interning. We were married halfway through his internship. Although he was working such long, hard hours, we didn't have much time together, but it was a great time.
I'd interned and been a resident at Queen of Angels, which is a very large hospital, one of the biggest in the country, private hospital. It's combined with Hollywood Presbyterian now. In Omaha, I was where I practiced for 10 years. Before I came here, I was on the staff of about 5 hospitals.
Omaha is really a pretty tree-lined streets with the world's worst climate. Good, warm people. It's a very generous community. I can remember my father making a sandwich for a guy who came to the back door because he was hungry when we were little kids in the 30s. People were hungry at that point. My grandmother had clothes in the basement that she would give people when they came to her door, and we just grew up like that. I've done a lot of volunteer work through the years, mostly here at Meals on Wheels. I was on the board, and I was chair of a capital campaign. I started as a driver when Sally Griffin was working there. She made sandwiches in the basement of the Carpenter's Hall and had them delivered before it got to be a building where it is now. And certainly there's a big need for it still.
We wanted to come to California. When I started in practice, general practice was the backbone of medicine. That's what I did, is general practice. Dr. Martin, I don't know whether you remember Dr. Martin, he encouraged me to come here. Said we needed general practitioners. We decided to move here.
He was very involved with the medical staff almost from the get-go. Showed great medical leadership, and then finally he transitioned to be our first director of medical affairs. That was a salaried position. He retired from practice. He couldn't have been a more perfect person to make that transition.
When I first started as a new grad, he'd show up walking the hallways, checking on how things were going. A gentleman and approachable and well respected by the nursing staff. He was a formidable figure at the main hospital. But I always felt, even as a new nurse, that I could approach him and ask him questions. If he was given a problem, he'd follow up and get back to you.
Well, when I first got to community hospital, it was a beautiful hospital, but it lacked a lot. 69, we didn't have cardiologists, and even when I got here, we didn't have an intensive care unit. But it just keeps growing and getting better. It's expanded from a good community hospital into a better than most big city hospitals. The community hospital accumulated lots of money that they didn't have originally. And that's how you build nice hospitals and do things for people. If you don't support the hospital, you don't have one. That's a Kansas answer.